So Michigan Medicine and Banner are both moving forward with building projects. If you and I were starting a building project today for a health system, how would we be looking at the room, at the ER, at other things post-COVID from a technology perspective?
Yeah, that's really interesting. So there's this whole new art and science around the patient room of the future, patient room next, whatever you want to call it. And it's not just the room, it's like everything else in the hospital, right? Or in the actual physical building.
Right. I mean, so let's just go basic. I mean, how am I going all wireless? No, you're not going all wireless. You're still putting cable in there. What kind of cable are you putting in there? And how extensive is the cabling that you're putting in there? What kind of density are we going to be looking at for, for the wireless in these rooms as well? I mean, how many monitors should we be considering? And if we're building this out for the hospital, should we be considering how we're going to build this out for a high acuity situation out of the home?
Yeah, the answer to all of the above is yes. In that, you're still going to be limited substantially by what the physical systems and the applications can pump out or pump in, so to speak. But just in terms of connectivity, you have to be wireless first, right? You have to have so much capability that not only do your clinical applications have the ability to leverage these wireless protocols, but don't forget about the patients themselves and their visitors. The visitors always get like completely shafted, right? They get stuck on this guest network that's like, baud modem speed at this point, and they're like, I can't even surf on, Facebook or Twitter or whatever it is without getting dropped 16 times. And that's a really crappy experience, right? So I think a lot of those experience-based things have to be built up. And then in terms of the technology, I think it's really about this whole notion of bringing together ambient listening, bringing together sort of automation and, like home automation type things where you actually have, control of blinds, control of temperature, et cetera, et cetera. So I think the technology needs are substantial. And that's why I say that there's this new art and science